And now we have some representation from the American Academy of Family Practice. And Dr. Reid Blackwelder, a family physician from Kingsport, Tennessee. He's president of the American Academy of Family Physicians. He represents 116,000 family physicians and medical students. Now, he too went to medical school, and he graduated from Haverford College in Haverford, Pennsylvania, got his medical degree from Emory University in Atlanta, and he did his residency at Medical College of Georgia in Augusta. Even was chief resident there. He's board certified by the American Board of Family Medicine and has a degree of fellow, which is a very special recognition from family practice. He's been a member of AFP since 1980. He's held many committee chairs and many important efforts and has risen to be their president. He's practiced for 21 years with the Wellmont Holston Valley Medical Center in Kingsport, Tennessee. And I'm delighted to present Dr. Blackwelder to you.
So one of the joyful things about one, having long CVs, and two, getting to be to these positions, as you two will recognize, is that first, we never know how to say no, which gets us in all kinds of trouble. And the trouble I just found out today is that a trip I thought I was making to Chicago on Friday, I'm actually making on Thursday. Yeah, so needless to say, the end of lunch was me trying to figure out how do I change all my schedules and explain it to my wife. Yeah. So with that being said, because I was planning to be here all the way through until the end of the session tomorrow. At this point, I need a few hours at home to preserve domestic tranquility, to unpack, repack, and travel again, because it'll be 2 weeks before I'm home. So, but I really appreciate the opportunity to come and be here. It's been a wonderful journey as an officer of my academy. And the most important thing really is about the relationships and about the networking and about the connection. And that's what this is about. So I greatly appreciate being invited to be here. And I do want to share a little bit about sort of who we are and what we do. I don't have the cool slides. I love the photos and the great breastfeeding rocks things. I'm afraid my slides are dull. I try to make up for it. I'm not dull. So if the slides bore you, just look here. This is actually what I did when I was running for office. I said, you know, you can choose these voices. Every one of them is wonderful. But when you choose the face to represent you, choose the one that no one will forget. So, with that in mind, I do want to basically tell you who we are. Because a lot of the stuff you already know. This is preaching to the choir. You don't need me to go through stuff about saying how wonderful breastfeeding is. We need to talk about some different approaches. So I represent 115,900 family physicians. These include medical students, residents, worldwide. I love that phraseology, from international to worldwide. We also care for everybody. We truly are cradle to grave. Now, I was actually the last family physician in Kingsport, Tennessee, doing OB until I said yes and got elected to the board. And the moment that I was sitting with my pregnant patients and I'm calculating their EDC and I pull out my calendar, I knew that was a bad thing for me to be looking at my calendar for when you were due. And that's when I handed off. And that's been one of the hardest things to give up, was giving up my OB practice. I still managed to keep engaged. I've got 1 or 2 partners that are seeing my folks, but it's different. I've lost that relationship. It's not the same. So it's really, really important as we talk to all the members of our organization and all of us together that we can share some of that passion and that joy as we go through this. One of the things about family physicians is that we do see 1 in every 4 visits, ambulatory visits in this country, see a family physician. Almost 30% of every medical student that's osteopathic and allopathic in this country are members of the AAFP. Now, the downside is, selfishly, they don't all go into family medicine, nor do they really stay in primary care, because that's a real interest that we all have, is staying in primary care. But yet we have them for really important periods of time. And what we do with that time is really critical. Because when you look at what we do as family physicians, we're really the cornerstone of relationships of the entire family, of every aspect of what goes on with the relationship between the mother, her child, and the family, and the community. So I want to touch base on some of those aspects. We do have 214 million visits, and we do comprehensive care. This is really important because while the process of preconception and getting pregnant and then going through that is incredibly special and powerful, I have relationships with women long before they think of being in the preconception phase. I have a chance to be talking about this from the moment the family first comes in, because even if I only see one member of that family, I'm still treating the family. Even if it's just one person, even if it's just the child that I'm seeing, mom or dad brings them in, I get a chance to talk about it. I know what's going on. I'm able to be a part of that relationship early on. And we can be talking about fears and things in different ways. A lot of times with my teenagers or preteens, unfortunately now, you're doing the sex, drugs, rock and roll talk. Because that's all about those issues that move forward. And I get a chance to see my patients as we continue in life to becoming a mother. And this is really important because one of the things I saw in the ABM, I guess May 2014, was the need to mother the mother. And that's really what we can do because, again, we don't discriminate against organ systems, disease processes, location in the hospital, age, or gender. As family physicians, we're able to create that safe place for mothers to be, for mothers, for the families after. And that's a really important aspect. That's why I'm really glad to be here to help tie all of us together, because we're all doing the same work and we need to know who each other, who we are and how we can help each other in this regard. Because a lot of what I'm seeing, even here, there's some questions early on, they're still siloing. Government offices and administrations don't communicate. And even now we have this wonderful paperless system, right? How many of you have a paperless system? That's in quotes. Yeah, you're not raising your hands because I can't fool you. I have more paper with my electronic system than I've ever had because the hospital at the top of the hill doesn't share my EHR platform. I can't communicate with it. So whenever one of my patients is hospitalized, my patient, I admitted them. I took care of them in the office, I admitted them. That record has to be faxed or scanned or something and printed in my office so then I can scan it to my EHR. It's ludicrous. Okay, so this is the reality we live in. So how do we break down silos? That's what a large part of this is. You already know this is good. Please be assured, we know breastfeeding is good. We have lots of policies. We have resources. We understand the same things that we've been talking about. I'm not going to go into that in great detail. Just to say that we do recommend breastfeeding, as all of you, for at least 6 months, preferably a year and even longer. We all know the benefits of that. Because we treat the family, going back to what happens when they leave the hospital, 75% are breastfeeding, and then that plummets. We have an opportunity when we're providing full care, and we don't always. I mean, sometimes families will see an obstetrician for maternity care because not all family physicians do OB. They may see a pediatrician. The truth is they're seeing somebody. We all need to work together. And if I'm taking care of a family and I know that you're seeing my patient for her pregnancy and you're going to see her newborn, then it's up to me to be a part of that, saying, how can I help? We might even have to do that weird thing. How many of you have this thing? Yeah, by the way, it's not a camera. It's actually a phone. It does a very cool thing. You can call people. Unfortunately, most of us, including me, as I found out that my world changed dramatically, was texting nonstop, not calling anybody. But you can call, you can communicate, you can break down the silos. And that's really what we need to do because we believe the same things about what we have to do to make a difference for our children and for our families. We also talk about all the bonding, everything else. Same stuff you've already heard, I'm not going to repeat it. But what we do is try to make sure our students and our residents and the family physicians understand this. And so we have an impact again, since almost 30% of all medical students are in the American Academy of Family Physicians. We can reach them even if they go into another specialty. So we need to continue to make inroads within the curricula of medical schools and within residencies And because our residents in a lot of programs, when I was at Medical College of Georgia, I crossed all departments because I would rotate with internal medicine, with surgery, with OB, with pediatrics. So I could take what I was learning as a family physician to other places and network and share. So again, we're sort of a kind of guerrilla warfare. If you look around, you'll probably find a family physician somewhere, and we need to be part of this process. So again, thanks for the invitation, because this is what we do. It's about relationships, connections, education. You know, docere, the root word for doctor, is to teach. And that's what a lot of this is. It's overcoming fear. It's overcoming the PR. It's overcoming advertising and learning how to reach people for better causes. And we're good at that. The other thing that's really exciting right now is this patient-centered medical home. It's one of those wonderful acronyms. How many of you have not heard of the PCMH? See, the power of advertising. Now, if I went around and said, what does it mean? That would be different. You'd go, and it's good, you know. I don't know what that is. And, you know, it sounds like a nursing home. It's a terrible name. And we stole from the pediatricians. They started the PCMH years ago, and then we put it into our future family medicine. The trouble is, it sounds like a nursing home. It just doesn't sound right, but it's basically the terminology, because anything that can be an acronym becomes part of bureaucracy. So we have an acronym, but it's truly about how do we create teams? How do we create the resources available? How do we recognize that a lot of care is now asynchronous? It's not face-to-face. Even home visits don't have to be home visits in the same way. They can be a call, an email, whatever the technology is or the preference of the patient and the mother and the family. But it is about teams. You know, especially in primary care, we don't have enough primary care physicians or providers right now. But we need to identify those team members and find a way to make sure we're all working together, that each role is unique, each role can not be interchangeable, but can augment what others do. And there are a lot of these things that don't require a physician that we need to make sure that we stress. So a lot of this really is about learning how to integrate processes, resources, teammates, people, taking care of family. Even if we're all doing different parts of that, how do we come together so that we actually create that patient-centered medical home? It's not about everybody in the same building or the same practice. In many ways, it's community-based care. It really is a way of taking care of things throughout. And family physicians are also, just as my colleagues, we say yes to lots of things, including community work. I know my colleague Tim Tobolik in the back was sharing a lot of the things he's done in his community. He's, like we like to say, he's a real person, not just a physician. He actually does things in the community, and that's something that we can all do. We can impact our hospitals. How many of you are on a hospital board? Okay, how many of you do something with the health department? Okay, and I could keep going on and on. You'd all raise your hands eventually. How many of you hate to raise your hands when speakers say things like this? Good. I got you to raise your hands. So, you know, I know that's annoying, but we all have impacts, and we all do more than we think we can do, and we can make that difference. We have position papers. This is really important. I want to make sure that you get a copy of our position paper. It's extremely thorough. It's being revised right now by our Commission on Health of the Public and Science. It should come out later in the fall. We're going to have a big push in terms of educating our students, residents, and family physicians, but I'll make sure you get that, because that should be a resource that we all have access to as well. We agree with all the different initiatives that we've already heard about. These are all things that we're very much a part of, the baby-friendly hospitals, et cetera. But a lot of this is a culture shift. And we have to recognize that we're all players in this. And what I was pleased to see is that actually one of the founders of ABM, Dr. Eglash, is a family physician. She also wrote our position paper that we're revising. She was one of the authors. So again, we're all related. You just don't always remember it or recognize it. That's my job. We're all related. We are also engaged in a lot of other organizations. We're also trying to support all of the baby and breastfeeding friendly initiatives. And we just need to do a better job of getting that out there. This is a critical public health issue. This is something we all know that we have to continue to address for many, many reasons, and we have to work together. This really is sort of a cornerstone to everything about healthy people. And we've lost a lot. We've lost nuclear families. We've lost that skin to skin. We've lost a lot for different reasons, and I see a real need to and a real interest in reclaiming that. We just have to make it okay. Whenever you have a culture change, it's scary. So our job is to work on that. So one or two other things as I go through this, not really questions, we'll have that in a minute, is to basically challenge all of you to get a little bit outside of your comfort zone. So I ask about this thing for a second, and we'll go through this. So you've all used phones. How many of you use email? Of course, yeah, you're laughing. Where's he going with this? And you're making you raise your hands again. I know that's annoying. How many of you do Facebook? Okay, that's not too shabby. How many of you tweet? Excellent. That's actually unusual. During the course of this meeting, how many of you have sent out a tweet? Good for us. I have no idea what the hashtag is for this summit. What is the hashtag? Make something up. You too. You can be the first. So how many of you have no idea what a hashtag is? Don't worry about it. It's not that important. But what is important is if you didn't raise your hand for either, and I would say especially Facebook, we need to think about that because the mothers of today are different than the mothers of yesterday. They do things on Facebook. They connect on Facebook. You have got to have a presence, and it's got to be interesting. It can't be dull. You can't look like a professional organization. Okay, you've got to do things different. Yes, ma'am.
What's your handle?
Very good. I was going to get to that because I've already sent out a tweet. I didn't put a hashtag on it. And I've already put out on my Facebook page, I've already taken a couple of pictures that sent them out, including the Lioness of Public Health. She's now on the... Very good. As that, I even put that, the Lioness of Public Health. That's how you'll be known forever. So on Facebook, I'm AAFP President. So if you have to, I don't think you, I forget if you follow me or like me. I think you like me now. You can't follow me, it's a professional page, so like me. But I try to put, I'm telling the story of my journey, but I'm also trying to put where I am and what's happening. On Twitter, I'm at AAFPPrez, P-R-E-Z. Now, if you look up Reid Blackwelder, you'll find me lots of places, but my personal accounts are dormant as long as I'm president. I'll be president until October 25th, not that I'm counting, and then I'll be chair for a year. But I really hope to connect. My email is Blackwell, B-L-A-C-K-W-E-L, at etsu.edu. But you can find me lots of places. Since I won't be here through tomorrow, please connect. That's how we move things forward. We've got to have relationships. We've got to find each other. We've got to work together. And part of what I do during this year is network and put people together. I don't always have the answer, but I can tell you who you need to talk to. So I know there'll be lots of other questions, but I'm going to go over and join my colleagues. I appreciate your time.
Yeah.